As far as the causes of hypertension, there are many, and oftentimes it's useful to have people check their blood pressure in their own surroundings at home, because it can be falsely high in a doctor's office. The first question is, do you have hypertension to a level that you should treat it or not? And let's say if you determine that, yeah, you do, it's consistently high, then what you're obliged to do is be really sure it isn't up for a real good reason. A very common one actually is sleep apnea. Sleep apnea increases as we get older. It doesn't just occur in people with big necks and things like that. But if your oxygen level drops while you're asleep and you don't know it, that's a huge stress to your body. So you release adrenaline in amounts that increase your blood pressure, including all through the next day. So that's an example of something that when you treat the cause, the sleep apnea, the hypertension goes away. And there's other common things. I think the one that is missed the most is, as we get older, we have a tendency for the CoQ10 levels in our heart to go down. And Q is the cofactor for the production of energy in all cells. And we make it real well when we're young, and then it drifts down beginning about age 30. Well, when it goes down even a little bit, the first thing that happens is it affects the heart muscle, because that uses more energy than any other part of your body. And what it does is it slightly impairs, we call it diastolic dysfunction. It's like a stiffening of the heart muscle. It's an impairment in how these fibers unlock. Well, when that happens, your body is so in tune to your heart's functioning that the very first thing it does to try to improve it is it increases adrenaline. Well, that does make the heart work better. It also increases your blood pressure. So in anybody with hypertension, we check their heart muscle function with an echocardiogram. It's a non-invasive thing. And if their heart muscle is in any way abnormal, we treat that. And 9 times out of 10, when that's normal, your pressure comes down. So those are two examples of things that are fairly common where you don't want to miss what's causing it.